Hello, everyone. My name is Scott Lamprecht. I am one of the president-elect candidates for the Nevada Nurses Association. It's a pleasure to meet you. This video is to give you a little bit of information about myself, my background, and my intentions and ideas for that position of president-elect with the Nevada Nurses Association. I've been a registered nurse for 21 years, graduated in 1990. I've worked mostly emergency room, intensive care, critical care, cardiology, a little bit of anything and everything. I also worked several years as house supervisor, assistant director of nursing, and also as a nurse manager too. About 6 years ago, I got into academia. I've been teaching for Touro University, Nevada. I've been there for 6 years. I am actually adjunct rather than full professor at this point. And in 2003, I started my own consulting company, Complete Medical Consultants. It's a training center with the American Heart Association. We do BLS, ACLS, PALS, NRP, specialty learning programs, all types of stuff. So even though I've been in education for the last few years, I still have been practicing at the bedside. And currently I'm completing my nurse practitioner. I'm doing the clinical hours, 600 hours of residency at this point, and should be sitting for my family nurse practitioner boards next summer. So once again, I graduated in 1990. I picked up my master's degree in nursing in 2006 with subspecialty in education and curriculum design. And in 2009, I finished off my doctorate in nursing practice. That's the new DNP in nursing. It's very much a hands-on and very active position. My final project for that degree was actually sudden cardiac arrest in adolescent athletes, and I developed my own screening program for that, implemented the research. I've been very active in the community, performing EKGs and physicals and doing all different types of things. I've been involved with the American Heart Association significantly. I am on the state of Nevada Emergency Cardiovascular Care Committee for the state, and I'm also the chairman of the Southern Nevada Regional Faculty American Heart Association Workforce Group for Southern Nevada. During the course of that, I have been involved in several trips to Reno. I have been asked as a clinical expert to testify for legislation and bills pending both in Nevada, up in Carson City, and I have also made 2 trips to Washington, D.C. to talk about funding for sudden cardiac arrest and stroke with the National Institutes of Health, and also meeting with the legislators there. So I met with legislative members in both Reno, Carson City area, and in Washington, D.C., not just the legislators from Nevada, but from several other states as well. So it's really been great, and I've really enjoyed my time that I've been able to do that in the last few years. And it's been nice to be able to transition to hands-on practice and getting into health policy and doing some of that stuff. As far as nursing goes in the state of Nevada, I think that the practice of nursing is extremely important, and I think there's a lot of issues and a lot of different components in that. In the sense of what are the nursing roles? How is the role of nursing changing with the 2014 legislation that's going to be coming out, and expanding the roles not only of nurse practitioners, but as floor nurses, telemedicine, that type of stuff, which is going to be a major chunk of the bill where we're expanding the healthcare services. And nursing is going to be a driving force behind that. So what does that nursing role look like? Unfortunately, the public still has an image that nurses are somewhat the handmaids of the physician, and that's just really not the case. And some of the television shows that are out there, some of the different articles that come out, don't always portray nurses in the greatest light. So I think we really need to focus on working on the professionalism image of nursing and getting the true role and the scope of nursing practice out to the community so that people actually recognize and realize what we do and how important that is. Collegiality with other disciplines and healthcare professions, I think, is extremely important too. We have, I think it's a fairly well-known fact that for a long time nursing has been kind of suppressed and repressed. And we need to reverse that. I think we need to be on the forefront. Nursing research and nursing knowledge and nursing practice incorporates everything from public health to bedside care to primary care to pediatrics to open heart surgery, you name it. Nursing includes it all, and I think it's so important for us to get that information out there, and with the other disciplines to realize exactly how well we can work together. We did have movie that came out a few years ago, and I thought this was a great line. It was from the movie Ants. The grasshoppers were talking and said, if those ants ever figured out that they outnumber us 10-1, our way of life would be over. And I think that's really what it is. We have so many nurses in the state of Nevada, but yet we're very inactive, and not a lot of the strength of our numbers is being used to help nursing issues out and conform nursing practice and change that image. And I think it's really important to get a grassroots effort in and really get people involved in this process, and that's how true change can really happen. And healthcare legislation, that's one way to do it. Healthcare legislation, healthcare policy. I have been involved, like I said, with the cardiac arrest stuff and trying to get EKGs as part of pre-participation sports physicals. We're working on that information. I've also been involved in the Clean Air Indoor Act. Have also been involved in removing the trans fats from the school dietary programs. And have testified on both of those. So it's been really interesting getting involved in the public health arena and talking with the legislators and the policy decision makers. And I think it's really important, too, that people understand that nursing is so important and out there, and it's not just a matter of being in the community. The primary care and at the bedside is where nursing is really the strongest component. We're the eyes and ears for that patient and advocate for them. And I think that's one of the key factors that we really need to make sure that people realize. And to go along with that is a good degree of autonomy at the bedside where we can make changes. We can do what needs to be done for the patients. So my role, I do practice. I am, like I said, completing my nurse practitioner at this point. Have been very active in research, and I've also been doing patient care and been teaching too. I think that's probably, at least from my viewpoint, the three main areas of nursing is being in primary care or giving care, doing research and teaching. I think those three really all blend together, and I think that's really important. So I've been in the AHA, doing a lot with that, Carson City and Washington, D.C., making the trips, talking with the NIH for funding, and the DNP project, of course, too. So lots of different things in a direction I never anticipated my career going, but it's been an absolutely fantastic experience. So NNA goals. I think we need to be looking at the legislation in Nevada. I believe we need to be working very strongly, getting new members in, getting that grassroots effort, and getting the nurses in the state of Nevada mobilized. I think that's what it takes to get the legislation and the health policies done that we need to have in place to promote nursing and promote increasing our professionalism and get the true image and nature of nursing out to the general public and to the other people in healthcare too. We need to act as common partners with the other groups that are out there. As far as some of the other nursing groups, specialty organizations, even other disciplines such as the physician assistant organizations, physical therapy, if we can form a united front, we can actually work together and get the policies and stuff forwarded that we need to. And once again, larger effort would be more effective for the patient base in the state of Nevada. Common goals, I think that's really it. It's all practice-based and practice-driven. I think this is where we really need to be in increasing the image and letting people know what nurses actually do. And I think getting that grassroots effort going, getting people involved, and being active, letting our voices be heard. So if you have questions, please don't hesitate to contact me. They were going to post my email address on the NNA website, but just in case you can't find it, it is Scott, S-C-O-T-T, at cmcnevada.org. So Scott at cmcnevada.org. Thank you very much for your time, and I look forward to working with you.